Thank you. Can you hear me okay? I'm going to just say that I have had the joy of practicing internal medicine at Mass General for 35 years, but my specialty was thyroid because I was fascinated at all the other things thyroid patients did. They're as you all know, they're incredible people. They're interested in all kinds of things. They have multiple abilities. And so I just want to, among other things, tell you, as you should know, that you're all incredibly interesting people. This does not go, this is people with autoimmune, the Graves' disease, the hyperthyroidism, hypothyroidism, people with thyroid lumps, although people with Graves' disease can get lumps, don't necessarily fall in as special a category as you with autoimmune disease. I want to first remind you of why or tell you why I'm fascinated by thyroid patients. First, to remind you, autoimmune disease really started with Dr. Addison, who diagnosed adrenal failure for the first time in a patient who also had a low vitamin B12 level and pernicious anemia. This was 1855. In 1926, which was sometime later, 50 years or so, Dr. Schmidt described adrenal failure and hypothyroidism for the first time. And that's when I guess a lot of people got the idea maybe there were a lot of immune disorders or disorders that were associated with immune disease. And so I followed my patients with an idea of learning from all of them. I wanted to know everything that had happened in their family, which side of the family was on, and all those sorts of things. So I can say, among others, Graves' and Hashimoto's disease can be associated with hyper or hypothyroidism. Thyroid eye disease can manifest itself as the most troublesome part of Graves' disease, or it can be the only sign. You may have no sign of thyroid dysfunction. All of these diseases can be independent. There's a condition called vitiligo in which you have white spots on your skin. You can also get lumpiness on the front of your lower leg called pretibial myxedema. There's a condition called alopecia areata, by which you have spots of baldness here and there on your head, and it may extend to complete baldness. You can have type 1 diabetes. This could be you or somebody else in the family. Pituitary failure or hypothalamic failure can occur in this same condition. Autoimmune hepatitis is another. These are all in families, but fortunately, you probably get only 3 or 4 or 5, even in your whole family. Myasthenia gravis is another one in which periods of weakness and inability to move around happen. Pernicious anemia begins to show up usually not until about age 50 or later. It comes on so slowly because you don't have enough vitamin B12 to make enough blood. Then you start getting numb feet and numb hands and other things. Your ovaries may fail early, may fail late, but due to inflammation in the ovary, this may be more common in people who've had Graves' disease. I was fascinated that hypoparathyroidism, the glands next to the thyroid that control your calcium, can also begin to function poorly, leading to troubles with seizures and such like. A multiple of different kinds of allergies, from asthma on down, also seem to be common, also more common than the general population, and recurrent hives for no reason at all can also be seen. And finally, prematurely gray hair. Now, I'm going to ask the audience. I notice a few people are pointing to themselves. How many of you have somebody, you or someone in your family, who had one gray hair before 30? Raise your hand, please. That's very good. Runs in my family. I guess that's why I got interested in these kinds of things. Atrial fibrillation is more common because of the hyperthyroidism and possibly because of some problems with the heart. Also, the fibrillation may come because the mitral valve seems to be more often mildly different than a normal mitral valve, and this may lead to our predisposition to cardiac arrhythmias. Ovarian failure, premature ovarian failure, hypoparathyroidism with a low calcium, low platelets leading to bruising, and so forth. So I just got awfully interested in why this was happening, and I have spent a wonderful time studying these things and trying to impart them back to patients. And this is why it's a pleasure to be here, listening to the frontal parts of thyroidology from these wonderful speakers. But I want to also hear back from you, and stop me anytime, because I'm interested in what you don't know and what you would like to know. Pregnancy can be tough for thyroid patients because they may have antibodies that block the functions of their ovaries. They may have trouble with abortions in the first trimester especially. About 16% of pregnant women get a TSH over 4 by the beginning of the third trimester. So that's probably, that seems to fit in what we think a little lower, but about what we think of the number of people who have autoimmune thyroid disease. About 33 to 50% of them tend to have thyroid trouble in them or in the mother or the baby after the delivery. The thyroid gland tends to increase by about 10% in size in the mother if the mother has a normal amount of iodine and is normal. If there's iodine deficiency, which is getting to be increasingly common, as I'll tell you in a little bit and define, about 20% of people get swelling of their thyroid gland if they're iodine deficient. Now the mother supplies all the iodine that the baby gets. Babies cannot do this. And I'm reminded of, when we were running the Thyroid Foundation, we used to say, where in the world do we need to help? And China was #1 at that time. There were so many people in rural areas of China who didn't have enough iodine, and there was no way to go into those communities and say, we'd like a 24-hour urine specimen from everybody in the community. It's not like coming to San Diego and trying to get that. You could get it here. There you couldn't. And it turned out when we said, what can we do to help these babies that may be born with basically no brain? A totally athyrotic baby may be so mentally deficient, as it was described to me, they're put on a leash outside of the back door and fed from a bowl. And that just staggered me. I had to do something about that. Well, it was simple. All you had to do was go to China, and every person you saw that was pregnant and before the third trimester, you could get a urine iodine from that woman, or you could just check her thyroid function. If the urine iodine was low, you give that woman 1 tablet of potassium iodide, and that takes care of her and her baby for the rest of the pregnancy. Not too expensive. Then, of course, we decided, well, maybe we should try this to every person who lives in China. But just about that time, the Chinese government decided they were going to fix the problem. And what they did was they said, and this was just about 3 years ago, we are no longer going to produce salt without iodine. All salt produced in China from now on will have iodine in it. And they've had major improvements in the decrease in the amount of these cretin babies being born just because of a lack of iodine. And ironically, it was about a year later that we decided to we're getting too much iodine. Some studies showed that it was a little more than we ought to have. So they decided to stop washing cows' teats with iodine solution. So immediately the content of iodine in milk dropped. They decided that it was wrong to put iodine in bread, even though it made it rise better. They didn't want to put it in bread in case people didn't want it. People might say, I'm not going to buy that bread again. So we took it out of bread. And now America is just about entirely mildly iodine deficient. We know how much a mother ought to have in pregnancy, and about 80% of pregnant women don't have that much. So please, as a parallel, when you go home, if you have, I found in our house sea salt that it had the iodine removed. I found our regular salt had no iodine. So if that's your situation at home, please get salt that does have iodine in it. You need it for yourself, and you need it in case somebody in your family gets pregnant. In looking at pregnancy, what we try to do is to say, are these babies okay, or are there risks? Well, the iodine was the main problem. After dropping by just that small amount of iodine in our diet, and a lot of people taking prenatal vitamins don't get it either. As a result, you need about 140 micrograms of iodine grams per liter. What we have is 17% of our population of pregnant women now have iodine levels less than 50 or less. So to be safe, we're recommending that women who are pregnant take about 220 micrograms of iodine. We can check everybody's urine, but a lot of people just don't want to hang around or come back and bring us a 24-hour urine sample. So what we're doing is supplementing every pregnant woman with 150 micrograms of iodine, and just check with your doctor and if you have any questions or concerns about that. In pregnancy, I want you to know that we check every single baby born in this country, and that's been going on for about 15 years now. Simply, you can't tell which kids have a need for more iodine, and you can't diagnose hypothyroidism except by a blood test. We can't use radioiodine to test the mother, and so that's not a way out. The risks of hypothyroidism may be early labor. The risk of hyperthyroidism in the mother may be early labor or thyroid storm. They tend to get better in the third trimester, worse after delivery with a fast pulse. Often prematurity of the baby is more common, and stillbirths are more common. So you see, treating every mother is the only way. We don't know which ones to treat, which ones are going to get in trouble. So that's what we do. The next thing, and the main thing I want to tell you about and get your help with, is that there's a lot of people we know that have problems. But so what? A kid with early graying hair can get along with it. Many things will show up as an abnormal behavior or a blood test on routine screening. But I wanted to see if there were things we might suggest that every pregnant patient have done. So in terms of an examination to say who is at risk, if you want to focus primarily on the people at risk, at the highest risk, we look for those things I mentioned at the beginning. We look for the white spots of vitiligo or pretibial myxedema. We look for people whose upper eyelid rides above the color part of the eye. We look for the alopecia areata, the spots of skin color that are gone. We look for people with type 1 diabetes. Type 2 doesn't seem to indicate necessarily that there is significant autoimmunity in the family the way type 1 does, the insulin-dependent kind. We look for evidence of anybody in the family who's ever had pituitary failure or autoimmune hepatitis, myasthenia gravis, pernicious anemia. More and more people by the age of 50 do have a vitamin B12 level, so we know that. We look for people who've had evidence of ovarian failure or difficulty getting pregnant, low calciums due to hypoparathyroidism, recurrent hives due to allergies, and all these are the ones we need to watch so carefully. Once we have that information, we then are trying to go to people in general and say, if these things are happening in your family, we think you should be sure that there are other things to look for that you may not know about. You may know about the risks of other people getting thyroid trouble if somebody has had Graves' disease, or if your father's mother was prematurely gray, you may know that that is a risk. So putting things back to where we began from, we need to be sure that there's no other Graves' disease or primary hypothyroidism, not lumps in the thyroid, but thyroids that fail. We need to look for the vitiligo spots or the pretibial myxedema on your shins, for alopecia areata, the spots of baldness, and we look for type 1 diabetes, and so forth. When we started looking, we started showing this up. So I said, I wonder if there's any way we could do this better. So I want to tell you how we decided to do it, and since they're mostly women here, tell me what we did wrong. We knew that prematurely gray hair was more common in these autoimmunity families. But I started asking my patients, is there anybody in your family who began to turn gray before the age of 30, 20 even? And half of them had gray. So say, I did. And I had no clue what color their hair was or that there was gray hair. So we then went on from that to say, I wonder how we could approach this, because I don't know who's prematurely gray anymore, except my mother. I knew about her. Could we just ask for more questions? For instance, you may not know that I was born a left-hander, because at age 5, with my father in India in the war, my mother found out that baseball gloves for the left hand were 15 cents cheaper than ones for the right hand. So she bought me a left-handed glove and said, this is your new baseball glove, just start throwing with your other hand. So I started stuttering shortly after that again. I'd stuttered as a little kid. But this was an example. So anybody have any ideas how we could follow this up? Who would you turn to get help on finding who was prematurely gray?
Hairdressers.
Right. We went, I luckily had a patient who ran the 3 biggest salons in Boston. So I said, do you think your hairstylist? I had no clue how long a woman sat with a hairstylist in, okay, let me ask a man. How long does a woman work with a hairstylist when she goes for her weekly haircut?
Weekly?
Well, 2 weeks then.
No.
3 weeks? Okay. Either of you, how long does a woman stay there?
45 minutes.
No, just the stylist alone is an hour. So I said, can I come and talk to your stylist about this? So she said, sure. So here's what we did. I went and talked to the stylist, and they were thrilled to have something to talk about. And they started off by saying, you know, I happen to know, of course, because I'm your stylist, that you are you were prematurely gray because you said you've had to color your hair since you were 18. And that's important. Do you know what that means? And they said no. Not one of them knew anything about what prematurely gray hair meant. And then the stylist, as we taught them, could talk to them about autoimmune disease, particularly thyroid problems, and how it may run in the family. And most of them did not know if they'd ever had a thyroid test done. So the next step, which you can try as we did, was to sit down and write a letter. The letter was to go to the doctor, and it started off saying something like this. We are doing a special research project to help patients like yours. And because she has such a wonderful hairstylist, you may not know that she began to turn gray when she was 17. And yet, as you know, and we knew that most of the GPs would not know this, as you know, this means they're at a higher risk for autoimmune disease like thyroid trouble, which is important to know about in case they have a baby. They might have increased risk for them or the baby for thyroid troubles and hurt that pregnancy. And we then said, this is a completely confidential study, and I would like you to talk to your patient, please talk to your patient about this and decide whether to talk to the family or explain more or refer her to a thyroidologist, whatever you think is appropriate. But if you haven't had a test done to find out if your thyroid is normal, we then talked about getting a T4 and a TSH test. But also talking about the rest of the family. And we talked in this getting longer and longer note, which ended up about a page and a half. Look to see if there are other autoimmune conditions in other family members, which means they may need to be checked too. And we said, please feel free to send copies of this. I know you can't send anything to us about your patient, but if you do find that this was helpful, please let us know. And so we started off that way. Beautiful letter, wonderful town, interested doctors we felt. And we sent the letter off, and guess what the results were? We didn't get a single reply. But anyway, thyroid disorders give you opportunities to do things like this. I would say, number one, look in your own families. Just like my mother's mother was prematurely gray. Nobody in my dad's family, but there were left-handers in that family. They were athletes who could do anything with either hand. So look in your own families and urge your friends at the next time you sit down, or at the next time there is a thyroid meeting for your chapter, please feel free to get somebody to come and talk about the risk for thyroid in other patients and other people in your family and how the tests are done and so forth. It has been my glory to work with Nancy in developing educational projects and hearing what she has done with this incredible foundation. But I just want you to know there is new things coming up that we hope to teach you with and your families, and I hope it's helpful. In closing, I would say be careful what you read, whether it be on the internet or in a book. I was so disappointed in the quality of books that were available that in 1982, I got the two best thyroidologists I knew, Dave Cooper and Chip Ridgway, to help me write this book called Your Thyroid, a Home Reference. We had a wonderful editor who'd had thyroid trouble, so I knew she'd be interested in helping. And she was so wonderful. She let us, we said, we've really almost got this book done. She said, I'll see you and we'll talk. So we came in with our book, and it started off, if a person feels like they are either nervous all the time or sluggish all the time, it is a very important thing that that person go to a doctor. She looked at that. We had finished the book. When we showed up, she said, I know what you've done because I've read it as far as I could stand it. She said, start this way. You start off by saying, if you wonder if you have a thyroid problem, you should think about whether you have experience and so forth. And it was just taking it from the usual doctor, third person kind of writing that is so uninteresting to putting it in the patient's place. To make a long story short, it was successful. We're now in our third edition, and they're now going to do what they call is it an e-book or an A-book? E-book out of it, and that's going to come out this year. And they've asked us to rewrite the whole thing again. So there are opportunities, and if you know of people who are interested in helping to write things and helping in public education, Nancy's group is interested just like we are. And I would be happy to talk to them and help them how to teach them how to get started. The really wonderful book that has now much more up to date is by Dr. Jeffrey Garber in Boston, called Overcoming Thyroid Problems. And it's very good, and if you want to look that up, you can still get our book on the internet for about $1.23 from whatever that company is that you can order books from. And so I would say, be careful what you read. Try to encourage people by getting involved in community education in your area. Doctors will help, and we will help you if you want to get started. Please let me know if you have any questions, and thank you for being here. Yes? Yeah. It was TSH testing. It was 15 years ago. And the trouble is, you can't recognize a baby who has no thyroid and is going to be a cretin. But if you don't treat them within the first week, they will have mental damage. So that's why every single baby born in this country has a TSH test at the time of delivery. It's produced, it's given, the result is given back to the doctor that night. It's a special route in every hospital in this country. And so that mother usually finds out that night. Although you hate to call a new mother who's just taken the baby home at 2 o'clock in the morning. So usually you wait until the next day. But you then get the mother to come in and give them the pills in their hand. And they can read things about this during pregnancy, that it's going to be checked. Yeah, that's tough.
That's really tough. And I have friends who are in the international school and health education in Bolivia. And I am presuming, without knowing, that they don't do this testing simply because the amount of babies who seem evidently like that
Yeah.
in Bolivia today. Do you know the degree of testing that's done worldwide?
There are, let me see, the world population, I think, is at 7 billion. 2.4 billion do not have enough iodine, are iodine deficient. And in some of those countries, babies are born and within a week they're established as cretins forever. So there's a big move on now, and China was the first one to make the big step. It's not expensive. We just need to put the iodine back into our salt and our milk and teach people that iodine isn't bad for you. So, any other questions or thoughts?
One in the back here.
Yes?
Do you think there's any correlation between that and like other things like autism, things like that?
Not autism, as I know. Don't think there's ever been a connection with those two, but you can imagine that in mild degrees, what we've done is we've studied mental function. You can't really evaluate a baby accurately until they're about 6. So it takes quite a while to get the research information, but it does turn out that if you look very carefully, we can't see that much difference in kids that were treated promptly. We worried that if we didn't treat them till the end of pregnancy, there might be a real problem, but apparently not. Well, thank you.
One more question.
Excuse me.
Anybody? Okay. All right.
Thank you
Dr.
so much. I really appreciate it.